Welcome to today's lecture on endocrinology and the complex hormonal regulation of the menstrual cycle. In this session, we will dive deep into the intricate processes occurring within a woman's reproductive system and explore the various methods of hormonal contraception available. Through understanding these mechanisms and their implications, we aim to provide you with a comprehensive knowledge base to guide your future medical practice. So, let's embark on this journey together. The menstrual cycle follows a precise pattern that involves several key hormones. The hypothalamus, a region in the brain, releases gonadotropin-releasing hormone, GnRH, which signals the pituitary gland to release follicle-stimulating hormone, FSH, and luteinizing hormone, LH. FSH stimulates the growth of ovarian follicles, each containing an egg, while LH triggers ovulation, the release of a mature egg from the ovary. After ovulation, the empty follicle forms the corpus luteum, which produces progesterone. Progesterone prepares the uterine lining for potential implantation of a fertilized egg. If fertilization does not occur, the corpus luteum regresses, and hormone levels drop, leading to menstruation. Understanding the hormones involved in the menstrual cycle is crucial for effectively utilizing contraceptive measures and family planning strategies. Folliculogenesis is the process of maturation of ovarian follicles, which house the oocytes, eggs. These follicles undergo various stages of development, primarily influenced by follicle-stimulating hormone, FSH, secreted by the pituitary gland. Eventually, a dominant follicle emerges, reaching maturity and releasing the oocyte in a process called ovulation, which is triggered by the surge of luteinizing hormone, LH. After ovulation, the ruptured follicle transforms into the corpus luteum, a temporary endocrine structure. The corpus luteum produces progesterone, which prepares the uterus for implantation of a fertilized egg. If fertilization does not occur, the corpus luteum regresses, leading to a decline in progesterone levels and shedding of the endometrium during menstruation. These hormones play a crucial role in contraception and family planning. Synthetic versions of these hormones, such as combined oral contraceptive pills, contain both estrogen and progesterone. These synthetic hormones act on the HPO axis to suppress the release of GnRH, thereby preventing the surge of FSH and LH needed for follicular development and ovulation. Progestin-only pills, commonly known as mini pills, mainly work by thickening the cervical mucus, preventing sperm from reaching the egg. They also cause changes in the endometrium, making it less receptive to implantation. Hormonal contraceptive methods, such as the contraceptive patch, vaginal ring, and injectables, similarly act on the HPO axis to inhibit ovulation and alter cervical mucus and endometrial lining. Understanding the intricacies of the HPO axis and how synthetic hormones interact with it is crucial in designing effective contraceptive methods and helping individuals make informed decisions regarding family planning. The menstrual cycle involves several key hormones, including estrogen, progesterone, FSH, and LH. Estrogen, primarily produced by the ovaries, promotes the thickening and proliferation of the endometrium. Progesterone, secreted by the corpus luteum, prepares the endometrium for implantation. FSH and LH play vital roles in folliculogenesis, ovulation, and corpus luteum function. Contraceptive hormones target the HPO axis to prevent pregnancy. Combined hormonal contraceptives, CHCs, such as combined oral contraceptives, contain synthetic estrogen and progestin. They function by inhibiting the secretion of LH and FSH, preventing ovulation, and altering the endometrium, cervix, and uterine tubes to impede fertilization. Oral contraceptive pills, often referred to as the pill, are taken daily and contain synthetic versions of estrogen and progesterone, which suppress ovulation and create a hostile environment for fertilization. Transdermal patches and vaginal rings work similarly but deliver hormones through the skin or vagina, respectively. Injectable contraceptives involve receiving a shot of progestin every few months to prevent ovulation and thicken cervical mucus. Hormonal contraception methods are highly effective in preventing unwanted pregnancies and offer additional benefits, such as regulating menstrual cycles and reducing the risk of certain cancers. Intrauterine devices, IUDs, are small, T-shaped devices inserted into the uterus. They can be either hormonal or non-hormonal. Hormonal IUDs release progestin locally, which thickens cervical mucus, inhibits sperm mobility, and thins the endometrium. Non-hormonal IUDs, usually copper-based, create a hostile environment for sperm, preventing fertilization. Contraceptive implants, which are small and flexible rods, are inserted under the skin of the upper arm for the purpose of preventing pregnancy. These implants release a progestin hormone, which is similar to the hormones found in combined hormonal contraceptives, CHCs. The progestin hormone works in three ways to prevent pregnancy: It suppresses ovulation, thickens cervical mucus, and modifies the lining of the uterus, endometrium, to prevent the implantation of a fertilized egg. Emergency contraception is a method to prevent pregnancy after unprotected sex or contraceptive failure. The morning after pill is a type of emergency contraception. It works by mainly preventing the release of an egg from the ovaries, but it can also affect the movement of sperm and the ability of sperm to fertilize an egg. This method should be used as soon as possible after intercourse to increase its effectiveness. It is important to note that emergency contraception does not protect against sexually transmitted infections. More serious but rare risks include arterial thromboembolism, especially in women with other risk factors such as smoking or hypertension. There is also a small increased risk of certain types of cancer, such as breast and cervical cancer, although the overall risk remains low. It is important to note that hormonal contraception does not protect against sexually transmitted infections, STIs. Lastly, rare allergic reactions to components of the contraceptive formulation can occur. It is essential for healthcare providers to inform patients about these potential risks and side effects before initiating hormonal contraception. For individuals who prefer non-hormonal contraception or cannot tolerate hormonal methods, various alternatives are available. These include barrier methods like condoms, diaphragms, and cervical caps, as well as natural family planning techniques that rely on monitoring fertility signs and abstaining during the fertile period. In conclusion, the menstrual cycle and the intricate hormonal regulation underlying it play a pivotal role in female reproduction. Understanding this complex interplay is crucial for providing effective contraception options tailored to individual patients. By comprehending the mechanisms of action, efficacy, and potential side effects of hormonal and non-hormonal contraception methods, healthcare providers can guide their patients towards safe and suitable choices for family planning.